Good day, dear viewer. Today's topic is pneumonia. This illness often raises many questions and even fear, especially when it comes to how contagious it is and how it spreads. I want to explain in detail what pneumonia is, how it develops, whether it is contagious, and also give you advice on how to protect yourself and properly treat this disease. Pneumonia is an inflammation of the lungs that can be caused by various pathogens, bacteria, viruses, fungi, or other microorganisms. Most often, it is caused by bacterial infection, such as pneumococcus. Viral pneumonias, including those caused by influenza virus or coronavirus, are also very common. Fungal pneumonias occur less frequently and mainly in people with weakened immune systems. Is pneumonia contagious? The answer is not entirely straightforward because it depends on the specific pathogen that caused the illness. If it is a viral or bacterial infection transmitted through airborne droplets, then pneumonia can be contagious. Most often, infection occurs through coughing, sneezing, or even talking with an infected person. However, it is important to understand that pneumonia itself is a complication that develops after the primary infection of the respiratory tract. Not everyone who comes into contact with a person with pneumonia will necessarily get sick. It depends on the state of their immune system, the presence of chronic diseases, age, and overall health. For example, children, elderly people, and patients with weakened immunity are at higher risk. How can you protect yourself from infection? First and foremost, follow hygiene rules, wash your hands regularly, avoid close contact with sick people, especially during flu epidemics or other viral infections. It is also important not to ignore vaccinations. Vaccination against flu and pneumococcal infection significantly reduces the risk of developing pneumonia. If you do get sick and experience a severe cough, high fever, shortness of breath, or chest pain, see a doctor. Self-medication can be dangerous because pneumonia requires the right approach to diagnosis and treatment. The doctor will conduct an examination, order necessary tests, and determine the specific pathogen that caused the illness. Depending on this, treatment may vary: antibiotics for bacterial forms, antiviral drugs for viral ones, as well as supportive therapy. It is important to follow the doctor's recommendations, complete the full course of treatment, and not stop taking medications early, even if you feel better. Pneumonia is a serious illness that can lead to complications, so do not underestimate it. In conclusion, pneumonia can be contagious, but it depends on the specific pathogen. The main thing is to follow preventive measures, strengthen your immune system, and seek medical help at the first symptoms. Take care of yourself and stay healthy.